Hello. County General Surgery Center.
Hello. This is Carla at Dr. Giordano's office. He accidentally sent you the wrong chart this morning. He'll send the correct chart over right away. Sorry for any trouble. Ciao.
Dr. Mitchell, stop the surgery. Dr. Giordano's office sent the wrong chart.
This isn't the chart for Melissa Johns? Oh no. Whose heart did we just give her?
Ouch. I sure wish the hospital had invested in all scripts.
Oh my.
Scott. Are you okay? Let us help you up.
No. I never made it home last night. I was so exhausted, I fell asleep at the bus stop. Oh, and I had the worst dream. When I finally woke up and checked my watch, it was already 8:30. I ran all the way here. I could really use a shower and a shave, but right now I'd settle for a cuppa and a donut.
Scott, I think we can accommodate that request. Let's hit the kitchen on the way to the boardroom.
Guys, to be honest, I'm just not sure what was decided, and still have not heard back from Dr. Foster. This is not looking good.
Well, this stinks. We spent so much time researching all scripts. I thought they really liked the system.
Dr. Foster. We are so glad to see you.
Before we get started, I've brought the team some Kool-Aid to celebrate a job well done in yesterday's presentation to the board. I come bearing good tidings. The board is interested in moving forward with all scripts. However, before they will finalize the deal, they want additional information on a few items. Let's get our CEO on the Polycom so we can hear from him.
Hello, my hit team. The board is very happy with your work and would like to move forward with the contract and purchase of the Allscripts CHR. At this point, we realize that Allscripts is a good solution for providers who use this system. However, the hospitals are our largest referral source and they use Epic, and most of our facility partners are still on paper. We feel Allscripts is a good post-acute care setting program geared toward the home health and hospice settings. In addition, this will be a less expensive option as compared to the hospital systems. Please start working on solutions to the potential weaknesses you identified.
This is exciting. Let's get started on our solutions.
I've taken the liberty of chaining Scott to the chair and cutting him off the job until we get this job done.
Okay, I'm awake now and ready to go.
We've been tasked with coming up with solutions to the very things we identified as possible cons. Melinda and Scott, would you like to come up here and get us started?
Let's see. The 4 areas we have chosen to focus on are as follows. Number 1. Lack of an interface with our inpatient unit medication dispensing devices. Number 2. Easy access to data and reports.
Number 3. Interface capabilities between Allscripts and our existing programs. And lastly, number 4, the small problem of interoperability with clinical partners. Allscripts does not talk to our Omnicell medication dispensing system. We could keep things status quo until NetSmart provides a solution.
Idea number 2 is to operate as Melinda suggested and wait for NetSmart to roll out the new HomeCare platform.
Allscripts has a system that pulls reports, but it is not easy to use. IT can work with leadership to develop queries for us to use. Another solution would be taking the time to teach leadership how to run reports until NetSmart simplifies the process.
Integration is always a possibility, but it can be costly given the sheer number of systems we currently use. Thankfully, PayerPath and the Mobilite phones are part of the suite and exchange information across systems. Currently, Allscripts quotes around $15,000 to look into the possibility of an interface solution. If we shake this tree hard enough, we might have enough for a project or two. Next, we will discuss the interoperability of Allscripts.
With the implementation of Initiative HL7, all healthcare software developers will be required to meet an agreed-upon set of standards to ensure compatibility between all healthcare information management systems. Until such time, there is one area uniquely affected by this potential lack of interoperability: document management. Allscripts document management is compatible with nearly all current practice management systems. However, in the event Allscripts is not compatible with a partner's system, we've developed a workaround solution: document imaging or scanning. While this may be somewhat time-consuming, it ensures our patients receive the appropriate level of care, for a quality outcome. It also helps to prevent duplication of services. Once compatibility issues are resolved, system upgrades will be made available that will allow effective communication between those partners' systems and their electronic medical records databases, thereby eliminating the need for this workaround solution. Another area of incompatibility that is being addressed by Allscripts and NetSmart is in the area of e-prescribing. Currently, communications regarding pricing may not always be up to date, and a patient's preferred pharmacy may not be listed in the Allscripts preferred directory. In the event the pharmacy is not available, the physician will have to print a hard copy of the prescription, or the patient will have to wait for the prescription to be sent via e-prescribe. If the patient would like their pharmacy added to the Allscripts directory, the patient and the pharmacy must complete a joint form to be submitted requesting admission to the directory. A process that can be time-consuming and bothersome for both the patient and the pharmacy. In the advanced system currently under development, however, the desired pharmacy can simply be added simultaneously with the patient record, based on the patient's indication of their preferred pharmacy, no longer requiring the completion and submission of the form.
I think we should bring dBmotion into the conversation as well. With patient information being scattered across many systems throughout the healthcare continuum, the dBmotion Health Information Exchange Platform, dBmotion solution, partially solves this problem in the interim by aggregating and harmonizing data from both Allscripts and non-Allscripts sources, and delivers the information clinicians need in a usable and actionable configuration, at the point of care, and in a familiar format and workflow. EHRs from a range of providers and vendors are sourced in order to provide a chronological patient record. This complete picture of the patient's history supports better clinical decision-making and allows providers to effectively coordinate and manage care. In addition, dBmotion EHR agent searches for patient information that exists outside of the servicing EHR and alerts the user if information exists in the wider community record. And dBmotion Collaborate offers web-based functionality to provide clinical teams and organizations with a broader view of their patients through provider-specified search criteria.
Well, That was a mouthful, but I think that's a wrap. Hopefully, we have provided viable solutions. Did you get all that down, Melinda?
Yeah, I think I got it all. I'll submit this to the board and Dr. Foster in the morning. Let's get home, I know Scott is beat. Nice work, everyone.